Bismillahirrahmanirrahim. This is our third lecture for the second semester, and it is totally related to the basic measurements we are using in the epidemiology. Tools of measurement. Measurement tools are ratio, rate and proportion, all significantly a relation between numerator, denominator, ratio, rate and proportion. Measurement. Ratio, a relation between two random quantities, that is when numerator is not a part of the denominator. Another measure may disease frequency is a ratio. It expresses relation in size between two random quantities. The numerator is not a component of the denominator, and the numerator and the denominator may involve an interval of time or maybe instantaneous in time. Broadly, ratio is the result of dividing one quantity by another. It is expressed in the form of x colon is the sign x colon y, x ratio y, or x divided by y. Measurement. Rate. A rate measures the occurrence of some particular events, development of disease or the occurrence of death in a population during a given time period. It is a statement of the risk of developing a condition. It indicates the changes in some event that take place in a population over a period of time. For example, typical rate is the death rate, birth rate, specific age rate, so on. And it is written as death rate is equal to number of deaths in 1 year divided by mid-year population into 1000. A rate comprises the following elements: numerator, denominator, time specification and multiplier. The time dimension is usually a calendar year. The rate is expressed per 1000 or some others round figure, 10,000 or 1 lakh, selected according to the convenience or convention to avoid fractions. Numerator is a part of a denominator, measures per unit time. Proportion. Simply we call it percentage. Numerator is a part of the whole denominator. Proportion is a ratio which indicates the relation in magnitude. Of a part of the whole. The numerator is always included in the denominator. A proportion is usually expressed as a percentage. For example, the number of children with scabies at a certain time divided by the total number of children in the village at the same time, multiply by 1000. Measurements in epidemiology. The scope of measurement in epidemiology is very broad and unlimited, and it includes the following: measurement of mortality, measurement of morbidity, measurement of disability, measurement of natality or birth or fertility. These are the same word. E. Measurement of the presence, absence or distributions of the characteristics or attributes of the disease. F. Measurement of medical needs, healthcare facilities, utilization of health services and other health related events. G. Measurement of the presence, absence or distributions of the environmental and other factors suspected by causing the disease, and measurement of demographic variables. The various rates The various categories of rates are the crude rate. These are the actual observed rates, such as the birth and death rates. Crude rates are also known as unstandardized rate. 2. Specific rate. These are the actual observed rates due to specific causes. For example, tuberculosis, or occurring in a specific group, for example, age, sex groups, or during specific time periods, for example, annual, monthly, or weekly rates. Third, standardized rate. These are obtained by direct or indirect method of standardization or adjustment, for example, age and sex standardized rates. Measurement of mortality. Traditionally and universally, most epidemiological studies begin with mortality data. Mortality data are relatively easy to obtain and in many countries reasonably accurate. Many countries have routine systems for collecting mortality data. Each year, information on death is analyzed and the resulting tabulation are made available, by which government mortality data provide the starting point for many epidemiological studies. In fact, they are the major resources for the epidemiological for the epidemiologist. Uses of mortality data. Statistics on causes of deaths are important and widely used for a number of purposes. They may be employed in explaining trends and differentials in overall mortality, indicating priorities for health actions, and the allocations of resources in designing intervention programs. And in the assessment and monitoring of public health problems and programs. Moreover, they give important clues for epidemiological research. Specific death rates. These are the certain formula which we are using for specific death purpose, mortality purpose. Number 1 is the specific death rate due to tuberculosis, is equal to number of deaths from tuberculosis during a calendar year divided by mid-year population into 1000. Specific death rates for male is equal to number of deaths among males during a calendar year divided by mid-year population of males into 1000. Third, specific death rate in age group 15 to 20 years of age is equal to number of deaths of person aged 15 to 20 years during a calendar year, mid-year population of person aged 15 to 20 into 1000. Fourth, death rate for January. The deaths are multiplied by 12 in order to make the monthly deaths are comparable with the annual death rate, is equal to death in January into 12 divided by mid-year population into 1000, and weekly death rate is equal to death in the week into 52, because in 1 year there is a 52 weeks, divided by mid-year population into 1000. Infant mortality. The numerator is the number of deaths among children 1 year of age reported during a given time period, usually a calendar year. Number 2, the denominator is the number of live births reported during the same time period. The infant mortality rate is usually expressed per 1000 live births. Maternal mortality rate. The maternal mortality rate is really a ratio used to measure mortality associated with pregnancy. The numerator is the number of deaths assigned to causes related to pregnancy during a given time of period. The denominator is the number of live births reported during the same time period. Because maternal mortality is much less common than infant mortality, the maternal mortality rate is usually expressed by 1 lakh live births. In 1988, the maternal mortality rate was 8.4 per 1 lakh live births. Age-specific mortality rate. Age-specific mortality rate is a mortality rate among either male or female. Both numerator and denominator are limited to the one sex. Age-specific mortality rate. The numerator is the number of deaths in that age group. The denominator is the number of persons in that age group in the population. Age-specific mortality rates are neonatal and infant mortality rates. Incidence rates. Incidence rate is defined as the number of new cases occurring in a defined population during a specified period of time. It is given by the formula incidence is equal to number of new cases of specific diseases during a given time period divided by a population at risk during that period multiplied by 1000. Reflects rates of disease occurrence, a change in the balance of etiological factors. Uses of incidence rate. The incidence rate as a health status indicator is useful for taking action A. to control disease, for research into etiological and pathogenesis, distributions of diseases, and efficacy of preventive and therapeutic measurement. These are the two actions. Prevalence. Prevalence, the term disease prevalence refers specifically to all current cases, old and new, existing at a given point in a time or a period of or over a period of time in a given population. The broader definition of prevalence are the total number of all individuals who have an attribute or disease at a particular time or during a particular period divided by the population at risk of having the attributes or disease at this point in time or midway through the period. Although it referred to as a rate, prevalence rate is really a ratio. There are two types of prevalence: point prevalence and period prevalence. This is the bathtub. Tap in which the water is flow in the tub is a number of new cases, while the water in the tank or water in the tub is a prevalence. Two things are happen. One, a patient will be a recover or patient will be a death. So this is the relationship between incidence and prevalence. Prevalence, total number of new cases, total number of cases, that is new plus old cases, divided by total population at a point of time, depends on two factors: incidence, duration of disease. Uses of prevalence. Prevalence helps to estimate the magnitude of health or disease problems in the community and identify potential high-risk population. 2. Prevalence rates are especially useful for administrative and planning purposes. For example, hospital beds, manpower needs, rehabilitation facilities, and etc. Thank you so much.